episode of CT in the car with other CT techs. The topic is going to be about urograms. So normally a doctor would order a urogram for patients who come in with hematuria. Anything else? I normally see like hematuria, so like if there's blood in their urine, then they want to see why. They've probably done other testing, and this is just an extensive of that testing to see what's going on. So in CT, everyone's protocol is different in a lot of hospitals. So does the hospital do non-contrast?
Yep.
Yes, right? So non-contrast first, and that's to see if there's any calcifications, of course, any kidney stones or anything like that, and to compare, because in a urogram, there's multiple phases. So the first phase is a non-contrast. And how much contrast do you guys give?
Like, 95.
For every patient?
Depends on the patient. Size-wise, right?
By weight.
Yeah.
But normally, so like, let's say the patient's over 200 pounds.
Still only 100. Because,
Because you're just looking at delay.
Yeah, delay bladder.
So it really doesn't matter that much of how much you give, because the last scan, you just pretty much wait till the body excretes the contrast and it empties out in the bladder. But contrast wise, ISO 300 or Omni 300, it doesn't have to be anything higher than that, because again, it's not an arterial phase, it's just all delays. So do you guys use chasers? No. So another facility that I'm at uses chasers, and I think it's pretty cool because it just helps push the contrast through, because at the end of the scan you want the contrast to end up in the bladder, so the chaser does help. Like I said, every facility does things differently. So first scan is a non-contrast. Do you guys have a venous phase?
Yeah.
Is regular 60-70 seconds?
Yeah.
So they do 3 phases, right? 3 phases, non-contrast, venous, and delay. How long is your delay?
10 minutes.
10-minute delay. Okay, so one facility does non-contrast, venous phase, which is 60 to 70 seconds, and a 10-minute delay of the contrast. And it's scanned from top of the diaphragm to below the pelvis. Pretty much get the whole...
No.
The bottom of the bladder?
So, normally the non-contrast, top of the kidney is through the bladder.
Okay.
Second phase, the venous, we do basically like the whole abdomen, right?
Top of the diaphragm to the pelvis. Okay.
Yeah. So.
And the delay is just top of the kidneys to the bladder again?
Yeah.
Because the whole point is to see the urinary tract. So from kidneys, how is your kidney filtering this contrast from your kidneys to the ureters to the bladders? And at another facility, it's only 2 phase, which is the non-contrast, get the whole abdomen, pelvis, and then a delay phase of, now I'm thinking, is it 2 or 3? No, it has to be 2, because it gives the contrast. Yeah, 2 phases. But this is how they do it. They do the non-contrast, and then they give contrast. Give like 30 or 40 milliliters of ISO and Omni 300, just letting it run after the non-contrast. Just let the contrast run, and then after 7 minutes, you'll press start, and then you give the rest of the contrast. I think they split it with 50 milliliters, and then 50 cc's, and then 80 cc's. So they give like about 130, 140, something like that. And then they just do the second run of the contrast bolus with 70 seconds. So that'll be 7 minutes, 8 minutes, 9 minutes. So 9-minute delay. Very interesting that they do it that way. Because they'll give contrast first, like the first 50, and then they'll wait 7 minutes, and then at 7 minutes they give the rest of the contrast, like 80, and then run it through. But the whole point is, as long as there's contrast in the bladder, then that's a urogram. And then if they don't see the contrast in the bladder towards the end, then they'll wait a little longer and then scan another scan of the bladder. but it is a long wait. It's not that it's a long scan. It's not a lot of work. It's just a lot of delays. I remember at the other facility, they made people get up, walk, right? To walk around to help your body with gravity. But not every facility does that. Anyways, I hope that was helpful and informative.